Hello and welcome back. Once again, I am Ashok Rajguru, your tutor. And in this video, we'll take a quick look at the anatomy and physiology and pathology involved in trigeminal neuralgia to get a better understanding about this disorder. The objectives of this presentation are to better understand the disorder, to see what allopathy has to offer, and what are the surgical alternatives available in case medication fails. Now, trigeminal neuralgia is considered to be one of the most painful conditions ever described in human existence. Most people describe that as a severe stabbing pain on one side of the face. It's generally unilateral. It is triggered by the slightest touch. And as I said, it's one of the most painful conditions to the extent that some people are driven to suicide, and we'll see the numbers in the next slide. The attack may last from a few seconds to a few minutes, and there may be long periods between the episodes of remaining painless. If you look at this graphic, it tells us that of the over 1.7 million known sufferers of trigeminal neuralgia, 26%, that means almost 1 out of every 4, will commit suicide as a result of the severe pain. That is why it is called the suicide disease. The pain is normally described as being sudden, severe, stabbing, sharp, shooting, and almost like an electric shock. So these are the descriptors that are used to describe the quality of pain. When it comes to etiology, or the reason why this condition arises, modern science admits that the causes are really unknown. But one thing is known, that the trigeminal nerve, and we'll see what exactly we mean by that term, if that is compressed by a blood vessel or maybe a tumor, in that case it can create a painful condition. There is also evidence that if the myelin sheath, which covers the axons of the nerves, is damaged or eroded, such pains can be experienced by that person. At the same time, while the myelin sheath of the nerves or the axons is described as a insulator, the exact functioning of that is still not understood, and there is no exact analogy in electrical circuitry. So when we are talking about conduction and insulation and terms like that, it's not exactly a replication of the electricity model from physics. The incidence rate of this is approximately 4.3 per 100,000, which means about 43 people per million of population. So it's quite a significant number. And unfortunately, if a fourth of them, that means about 10 to 12 people, would be committing suicide every year out of sheer pain in a given population of 1 million. We'll take a quick look at the cranial nerves. Now, cranial nerves are nerves that emerge directly from the brain, in contrast to spinal nerves, which emerge from segments of the spinal cord. And these nerves, the cranial nerves, they relay information between the brain and those parts of the body which are residing in the neck and the head. So spinal nerves emerge sequentially from the spinal cord, with the spinal nerve closest to the head, that is the C1. But these nerves are emerging from the brain before the C1. So that is something you must clearly understand. So I'll now show you a graphic. This is a section of the brain a schematic diagram of a section of the brain looking from behind upwards. So these are pairs of nerves, one for the left side and one for the right side, and they are numbered, and most people who are doing a bachelor's degree in anatomy or in medicine, they will be expected to commit these names to memory, but we will not be doing that at this stage of time. So if you see the right hand side of the diagram, you will see that the number 5 written in the Roman V is the trigeminal nerve. And in fact, there are 3 parts of those. They are identified as the V1, V2 and V3, and we'll shortly see what they do. But they are actually 3 pairs, and that is the reason why these are known as trigeminal, which means 3. Geminal is twins, which is a pair. So that explains the derivation of the name, and this is what they look like. And this schematic diagram is a pretty good representation of what you could expect to see if you had the opportunity to see a dissected section of the brain. This graphic here shows the 3 regions which are served by the 3 branches of the trigeminal nerve, and it illustrates the area which is being served by these. So they have sensory and motor functions, which we shall just see. What is known as the V1 is the ophthalmic nerve, and that's a sensory nerve. The V2 is the maxillary. It shows the region in the cheek and the upper lip and the side of the face. That's also a sensory functional nerve. And the mandibular is both sensory and motor. So your jaw movement and other such things are interfaced by these nerves. It should be understood that in fact the tongue, the sensory part of the tongue, except the taste, is done by the trigeminal nerve, the maxillary part, whereas the taste function is done by the number 7 cranial nerve. But we are not talking about that at the moment. Another interesting fact which you would like to know is that sneezing abnormalities may be due to irritation of the trigeminal nerves in the nasal mucosa. That would provide a very important and a vital clue to the study of remedies, because if there are some remedies which have been proven in the clinic to be effective for trigeminal neuralgia, it would be worth taking a look if they had paroxysmal sneezing as a symptom during provings or in clinical trial provings. It would be an interesting study. I have not done that, but maybe we could do that at a later stage on the forum. Let's take a look at what allopathy has to offer in terms of medication. Allopaths will first try anticonvulsants, and they are known to have side effects like drowsiness, dizziness, double vision, nausea. Or they could be giving muscle relaxants, antipsychotic drugs, and in case the pain is very unbearable, they could prescribe painkillers derived from opioid compounds. And it is said that they are effective in 80 to 90% of the cases during the episode, but there's no final solution to this particular disorder. Many advancements have been made in the field of surgery in the past few decades, and these may include injections of anesthetic drugs into the nerve itself. There is also another technique known as a radio frequency lesioning. It means they actually sever or they create an injury or terminate a nerve so that the pain is not transmitted. There is also something known as a balloon compression technique. In recent times, there is a gamma knife, which is a non-invasive technique, which really uses a very sharply focused beam or ray of gamma rays to surgically excise parts of the nerve which are creating a problem. And then there is a microvascular decompression. This is a major procedure which requires opening the skull. It's a long procedure. It has its own risks. It is done under general anesthesia. But there are cases where people will end up with facial numbness or stroke or even death. The chances of a patient dying as a consequence of the surgical operation is 1 in 200, which is 0.5%. So in summary, what we saw in this video was the rate of incidence, which is about 43 people per million. We also looked at the suffering, which is extremely intense. In fact, it has been called the suicide disease, which can drive people to commit suicide because the pain is intolerable. We also saw the areas that are affected by the 3 nerves, and we took a quick view of allopathic medication, which is essentially palliative, and the surgical options that are available now. So thank you very much for your attention, and I hope you were able to do a quick review of your knowledge of anatomy, physiology, and pathology. And this will help you to understand the suffering of the person better. So thank you very much, and see you in the next video. Bye bye.